All right, everyone. Happy National Latino Physician Day. I want to thank everyone for taking time out of their Sunday to come and join us. This is only the second year, but I think we can officially say this is a national movement. Yes. So Dr. Michael Galvez will be speaking, myself will be speaking and giving you a little bit of background, and then we'll have national speakers that are gonna be talking today, people that are leaders that are shaping the field of not only just for Latino medicine, for all of medicine. So I wanna start off by thanking the Office of Diversity and Medical Education, Office of Faculty Development and Diversity, LFAM, which is sponsored by OFDD, and of course the School of Medicine. You know, this event here has been made possible from the sponsorship of Stanford. And since I've gotten here 2 years ago, I can honestly say that, you know, I'm looking at Dr. Rena Thomas, you know, her mentorship, Dr. Bonnie Maldonado, who couldn't be here with us today. I mean, it has been instrumental in allowing and giving us the space to grow. And I think that's very critical. I need to start off by saying that. So thank you.
Good morning, everybody. Thank you so much for having us. And so what I was going to start off a little bit here is just my story. So I did terrible in high school, had a 2.8 GPA, had A's really only in PE, and got my act together. And community college was amazing because whatever they tested you on, they taught you. And that made a lot of sense to me. And so I went to community college. I then went to UC Berkeley, and it was incredibly hard. And when I was applying to medical school, I fortunately had a mentor who told me, you know, you've done all the things that you're supposed to be doing. You're doing research. And I got rejected from Stanford. And I'm actually wearing the same suit that I interviewed in 19 years ago. But I was rejected. No, the story gets interesting too. I was rejected from Stanford, and I had done all this research and I updated them, and he's like, why don't you appeal? Why don't you send them a letter? You've been doing more research, appeal. And I got interviewed, and that's what I interviewed in, and I was accepted. And Stanford was amazing. I spent my time as a medical student taking advantage of all the opportunities, and I got to become a plastic surgeon. And I was here for 11 years, but my trajectory was different. I was interested in hand surgery, interested in working with kids. When I would go to conferences, when I talk to others, they're like, oh, you're Latino, you should be doing primary medicine. And I was like, I'm going to do plastic surgery. I want to specialize. And so I was discouraged from specializing. And I was actually even discouraged from going and taking a non-academic route. And so that's where, you know, now I work at Valley Children's. I have my dream job, which a lot of people don't get to say, but I get to do very complex surgery to help kids with hand differences, with trauma, in an area that didn't have some of that care, where they would have to travel 3 or 4 hours away. And so that is where things started, just thinking about the trajectory. And so this idea of National Latino Physician Day, I essentially, throughout my training, I was seeing that there wasn't a significant change through medical school. And as I finished, I was seeing the same amount of a low percentage of Latinos in medical school. And I saw these small programs across the state where they would have maybe 12 students and maybe 2 were Latino. And I was like, how is that ever going to solve this problem? So I saw no urgency. And I even approached a department where there's 100 faculty and only 3% were Latino. And I ended up having meetings with the diversity, equity, and inclusion staff, which resulted in no actual discussions with the leadership, and therefore no traction, and therefore no change, despite, I just told you, my trajectory of like, hey, I care about the community. I know how to take care of patients, and I can see this problem. And then obviously discussions with Dr. Padilla, and we came up with this day, and that 6% is not enough. And so this idea was outside of any organization. This is a grassroots effort with the goal of including everybody as a stakeholder, all types of Latinos, Latinas, Latinx, Latine, Hispanic, generation, diversity. There's just Afro-Latinos. There's so much beauty in us being Latinos and the patients we see. And we thought that we needed to alert the public. And so this is a tweet. This was started based on a tweet. just like this, out of frustration, we have to create this day. And so we came up with this idea, right? We're looking like we're selling T-shirts at the flea market. But it was, it was powerful. It was compelling. People were like, hey, in talking with every Latino, Latina, Latinx person that we would talk with, we would see, and the conversation was immediate buy-in, where, yes, this needs to change. And so we started this T-shirt campaign. We had a few partners initially last year, about 19, which we're very grateful for. And obviously the Latino coalition with the National Hispanic Medical Association, LMSA, everybody was essential here. And there's a long list, but I can't go through it all, and I'd love to. And we did this massive campaign. We had 1,000 social media posts. We had 14 million views. And this is this year. Now, and I have a full-time job. I work as a pediatric cancer. I have to talk to families in Spanish and think about their surgeries, but this is something that had to happen. And so we have over 90 organizations, major medical organizations, medical schools, hospital systems that see this problem and have joined us. And so that's where we're here today. And this has been, the Valley, the celebration they had at Santa Clara Valley was so inspiring. They just had this past week at Kaiser Permanente. Hundreds of physicians joined in. Amazing work at UC Riverside. There's all these, and this is in Iowa, and all these, and I can go through a whole list of them. Please see our website. And we sold with LMSA, we sold 1,500 shirts this year for this day, 30 pieces of TV and online media, multiple proclamations, and the work that the Latino groups, especially the National Hispanic Medical Association, and there's a whole list, have brought together this actual legislation with Dr. Raul Ruiz and Doctora Yadira Caraveo, who are first generation Latino, Latina Congress people who have introduced this as an official resolution, and with the hopes of the Senate introducing it as well. And so this is a day, it seems like it's just a day, but as you guys have seen, this is a movement. We are trying to create awareness that 6% of physicians that are Latino is not enough to serve the patient population. And we want to celebrate those doing the work. Like today, I'm so grateful for all of us that are not only just doing a good job, doing an outstanding job of connecting with patients, of explaining everything in detail, of not being in a hurry and taking full care, and then encouraging the next generation to join us, but not just saying, hey, come join us and just do it, just work harder. It's not Nike. We want a supportive environment, right? We want to say, hey, what are the socioeconomic barriers you're facing? Hey, why are you working and this other medical student isn't? There's so many barriers that have stopped Latinos in their track, and what we'd like to address are these systemic problems. So we're highlighting this ethical responsibility that institutions, hospitals, and medical schools have in increasing Latino and Latina representation. Thank you.
Thank you, Michael. It's very interesting, as Michael shared his story and he came up with this idea and he called me, I was like, yeah. And his intro, by the way, is literally, you can copy and paste because we have so many similarities in our path. We're both from the East Bay, so I like to say we're locally raised. I did not have 18 years, I had 15 years of training, so that's the only difference. But I was also discouraged from the specializing, and the road was hard. It was hard finding mentors, finding people that look like you to succeed. So let's talk about the why. Why are we all here? Latinos are the fastest growing minority group, ethnic group. And by the year 2050, it's estimated that 1 in 3 people in America will be of Latino descent. And California, currently 40% of the state is Latino. That's expected to go to 50%. 48% of babies born are Latino and Latina. 48%, 1 out of 2. That is the direction we're heading in. So we really have to ask ourselves, how can we meet the demands of the patient population? Cancer is the leading cause of death in the Latino community. In COVID-19, there was several studies, especially during the initial heights of the pandemic, where undocumented immigrants and younger immigrants were 11 times more likely to die from COVID. Of course, you think about our essential workers who can't take time off. Undocumented status is a social barrier, and of course, chronic health conditions. In 1990, 4% of physicians were Latino, yet only 9%, or actually 9% of the population identifies Latino in the US. Today, 19% of the US population is Latino, only 6.9% are physicians. 2050, where's the population going to go? We're going to be 28%, some studies 28 to 30%, roughly 1 in 3. Where will we be? And that's why we're here today. We're here today just to really ask ourselves, what is this responsibility that we have to increase the numbers? Because it's not just identifying as Latino. Think about the language barriers. If you look in the academic setting, only 2% of full professors identify as Latino, Latina. So this has enormous downstream consequences, not just in meeting the demands of our patients, but in also, professors and people in academia lead the narratives. We need more people to lead the narratives. A simple question I want to ask you guys: what does a diverse medical school look like? J.A. Isola is the Dean of Diversity at the University of Pennsylvania School of Medicine, the first medical school in the nation. I think it's let's see what our colleagues and other leading institutions say. They asked her this on NPR: what is a diverse medical school? A diverse medical school should represent the population that the medical school is serving. And I think this is such an elegant and simple but powerful message. And she said this on air, and I completely 100% agree. So we have to understand the local challenges that we have, right? A medical school in Baltimore, Maryland is going to have inherently different challenges than a medical school in California. And I think that's a narrative that's missing in academia. This is from the Dean's report. This is the Commission on Justice and Equity recommendations, a very important report that was written here roughly 2 years ago. And I just want to highlight the bolded portion of the report, which says that reflecting the demographics of the broader US population, Stanford Medicine can create immediate and measurable impact. Well, what are these demographics of the US population? We have to talk about California's, and this is all of the demographics that I mentioned. Spanish as an underrepresented language. This is something that hasn't been talked about. UCLA Latino Policy Institute has brought this forward. Maybe we should look at languages, and let's think about that. If you're a medical school in California, why shouldn't you be bilingual? Why shouldn't a certain percentage, 50%, be bilingual? If, I tell medical students all the time, when you come and rotate on Children's Hospital, I work as an obstetric anesthesiologist, you're going to be talking Spanish. So maybe quantifying that. And I think that's something that we can do almost immediately and say, we should look at a percentage of medical school applicants and see, should we quantify or should we require bilingual skills? Why? Because 84% in Children's Hospital, 84% of translation services when they're requested are in Spanish. That's a lot, guys. That's a lot. And so I want to, I'll finish with this slide, and then we're going to introduce our Dean Minor, who's here with us today. But let's think about community college pathways. Most Latinos in the state of California attend community college after high school. And this is also true for Black students who, once they graduate high school, more likely to also go into community college. Tapping into that pool. Why? Because there are programs, guys. California Med Scholars Program. This is a funded program. It's received $12 million by the state of California. It has funding to continue. And it's a great program that basically puts students in a supportive environment who are in community college, but it doesn't guarantee admission. Let's take it a step further. Maybe a subsegment of medical school applicants should be guaranteed admission for students who come from community college. This is vital. These are talent pools. And we have to look out also for socioeconomic diversity, because that's important too. So I'm going to stop my slides here, and I want to start off by thanking Dean Lloyd Minor. Thank you for coming and joining us. You have such an extensive intro that it's so impressive. But Dean Lloyd Minor is a scientist, surgeon, academic leader. He is the Carl and Elizabeth Newman Dean of the Stanford University School of Medicine. He's held that position since 2012. He's also a professor of I should say that as an anesthesiologist, right? I should be like ENT surgeon. Can I say that? He's a professor of otolaryngology, head and neck surgery, and a professor of bioengineering and of neurobiology by courtesy of the Stanford University. Dean Lloyd Minor, thank you so much for joining us. I'm going to put it on the front side. Sorry about that, Dean.
No problem.
Here we go.
Thank you. Dr. Padilla and Dr. Galvez, thank you very much for sharing with us your amazing stories, your journeys in life and your journeys in medicine. I know I speak for everyone here today to say personally how moved I am by all you've accomplished, and even more so by what I know you're going to continue to accomplish in the future years of your amazing career. So thank you for inspiring us, for the people you serve every day, for your dedication, your commitment that you live and breathe in your actions to diversity, equity, and inclusion. Let's have a round of applause for Dr. Galvez and Dr. Padilla. I also want to say and acknowledge that I see in the audience today many people who have been helping us at Stanford in our journey in diversity, equity, and inclusion for many, many years. Dr. Mendoza, other colleagues here today. I have been moved and inspired by those who have had this flame burning brightly for years before I came to Stanford. And it's been my privilege and honor to learn from you and to be able to work with you in bringing us to today and to what I know is going to be a very bright future because of the collective dedication of all of us. Now, there are many, many reasons why we should be focused on diversity, equity, and inclusion, why we should be focused, as you just heard so eloquently from Dr. Galvez and Dr. Padilla, why we should be focused on improving the representation of our Latina community in medicine. First, we know that organizations that represent the diversity in society, and specifically, as was pointed out by Dr. Padilla, the diversity in the communities they serve, those organizations that have represented in them that community make better decisions. They do a better job of their core mission. They do a better job of serving the communities that look to them for leadership, that look to us for serving the needs of communities and for advancing our specialty, advancing our field in ways that serve their community. So it's an imperative that we continue to focus on improving representation and on making sure that we're creating a community that welcomes everyone, a community where we can exchange ideas, where we can meaningfully grow and learn from each other, and where we will learn from the diversity of experiences that brought us to our community today. We know that just as we have a lot of work to do moving forward, and you heard some of the important reasons why we do have a lot of work to do moving forward, it's also important for us as a community to celebrate where we are today. Not from the standpoint of being complacent or taking our eyes off of what we need to do in the future, but for recognizing that because of the dedication of so many of you in this room, we are a more diverse and equitable community than we were a decade, 2 decades ago. We know we have a journey moving forward, and we know that we have to keep our eye and our commitment firmly focused on that journey. But our path on that journey will be accelerated and improved when we take time to celebrate who we are in the room today and how we can build upon what has been already done to make the future even brighter and even more impactful. So I'm honored to be here today. I look forward to the program, to learning from the many people who will share their perspectives, their ideas. I learn from you. I learn from your dedication. I learn from the impact you're already having. And I also want to acknowledge my colleague, my friend, Paul King, the president and CEO of Stanford Medicine Children's Health and Lucille Packard Children's Hospital. Let's have a round of applause for Paul King. Paul King, David Entwistle, and I have the privilege of working together, and we all share a strong commitment to making our community diverse, equitable, and inclusive moving forward. And before turning the podium back over, I want to acknowledge our Chief Equity, Diversity, and Inclusion Officer, Dr. Joyce Sacchi, who's here with us today. We've been so pleased. we've been so pleased to work with Joyce, to learn from Joyce during the year that she's been with us. And she's already having enormous impact. She's building an office that is having enormous impact. And Joyce, we really treasure your partnership and the experience and dedication that you bring to us. So let me turn it back over to Dr. Galvez and Dr. Padilla, and thank you all for being here to share this important event and moment together. Thank you.
Thank you so much, Dean Minor. Thank you, Paul King, for coming and joining us today. We really appreciate the sponsorship, and Joyce Saki. Thank you so much, Dr. Saki. So next up, I want to bring Dr. Fernando Mendoza to the podium. Dr. Fernando Mendoza has been, I'm gonna say, he's been like my tío here. And well, no, not abuelito.
Some of the medical students have been calling us Theo, so we're transitioning to.
Thank you. All right. And yes.
Well, I've been at Stanford for 50 years, and it is a pleasure to see these two young physicians carrying the torch. At the end of the day, what has made Stanford great is the people and the leadership. And I think we're very lucky to have the leadership we have today with Lloyd, Paul, and David. It's going to make a difference. I have the pleasure to introduce Dr. Elena Rios. But just before I do that, I just want to reflect on the community college effort and my colleague, Ron Garcia, who has been my partner for that 40-year effort on community colleges. And I think that your examples are really key. And I think that was one of the things that drove Dr. Elena Rios. She has worked across the country to make all of us from all backgrounds be successful. You know, the issue about healthcare is really fundamental to what we are as human beings. When you're sick, you need the best care. And I think Elena has been the torch for that for Latinos in DC and across the country. I could read this whole document of all the accomplishments, but just let me highlight a couple. One is when you're a woman and you're a Latina physician, it is difficult to be in the room. But Elena has been a champion. She has changed the world in DC and across the country. She has gotten awards from the Congress, from societies, from the National Academy of Medicine, and from Stanford Hall of Fame as a Stanford alumni. But I think the other thing she's done is inspired the next generation, this generation that we're seeing today. And without people like that, we would not be here today. So I think it is my great privilege, I know it's my great privilege to welcome Dr. Elena Rios to tell us a little bit about her thoughts about our future, because I think with her past, she can light the light for the future. Elena.
Oh, all right. Thank you, Fernando. Fernando's been a champion in my life too, and Ron here at Stanford. So I was an undergrad at Stanford back in the 70s with Javier Becerra, who's now our Secretary of Health and Human Services, who actually just presented 2 MOUs to us this week at the Hispanic Heritage Month, first Hispanic Health Summit in Washington, DC for HHS. An MOU to the National Hispanic Medical Association, which does advocacy and has a membership. And I want to invite everybody, and especially Cesar and Dr. Padilla, for Michael, for having done what you've done, this grassroots effort. And I want to be able to develop more of an NHMA advocacy network. For a rapid response network, writing letters. We do this all the time in Washington. We don't do it with all the grassroots that you have connected to. We have a rapid response network that we have to do all the time. And we also have meetings with Congress, and there's no reason why we can't have meetings through our chapters at the local level with our congressmen, with our assemblymen, and Assemblyman Arambula here. We just met with him a couple weeks ago in Sacramento with our California Leadership Fellowship. which are doctors from around the state that are getting involved with our advocacy. We also had a MOU presented to the National Hispanic Health Foundation, which gives scholarships. We have a National Hispanic Health Professional Leadership Network, scholarship program for Latino students that are in medical school, nursing, public health, pharmacy, PA, and public health. I think I mentioned that already. But we have been doing scholarships since 2004. It's almost 20 years. And next year will be our 30th anniversary of the organizations, both organizations. We're not having a conference. We're having a leadership summit. We're inviting people to come and tell us where should we go the next 30 years. And I think this is where we should go. More grassroots efforts to connect and network with Latino pre-meds, medical students, and doctors. And there's no reason why we can't all work together in our pursuits ahead. So I want to celebrate today, and there's just a couple things that I wanted to say. Celebrate today as a National Latino Physician Day, and I want to tell you how proud we are to have worked with the anesthesiologists in Washington, D.C. Our Director of Government Affairs actually has been shepherding this for the last 2 or 3 months now to get the resolutions, and they were passed both in Congress and in the Senate. And the last line of the resolution, that just all the reasons why we needed to do this, but the last 2 lines are, I don't know if I can do this, is resolved that the House of Representatives, or the resolve of the Senate, supports the goals of increasing the number of Latino and Latina physicians in the United States and increasing diversity in the medical field, and supports the designation of National Latino and Latina Physician Day. That is the resolution. And the other, I think the other thing that I wanted to say was the Congressman Raul Ruiz from California is a doctor. Congresswoman Yadira Caraveo from Colorado is a doctor. The Congresswoman Maria Salazar, a Republican, is a doctor. All 3 of them championed this resolution in the Congress. And on the Senate side, Senator Alex Padilla is from California. Senator John Cornyn, Republican, is from Texas. So we had a bipartisan resolution and championing of the efforts that we are here today to celebrate. So the other thing I want to tell you is what in Congress right now we can advocate for that directly impacts what we're talking about. How do we increase the number of Latinos? Congressman Reese, HR 4837, Building a Healthcare Workforce for the Future Act. This is brand new. He introduced it in September. State grants, not medical school grants, state grants for new scholarships. Scholarships that you have to be enrolled full-time in medicine, dentistry, nursing, pharmacy, or other graduate programs in behavioral health. You have to have good academic standing. You could even be a resident in the residency programs, but you have to serve a year after you get the scholarship and after you finish your graduate school, which means a giving back service. That's new. The idea is that there should be a matching from the medical school or whatever schools get the funding, or I should say from the states, $20 million. The other program is mentoring. Again, mentoring from the faculty. Faculty become mentors. And that there should be leadership component and partnerships within the community that you serve for another $20 million. And then the last item is new competencies program for medical school and health professional schools, $10 million to develop new competencies within the group of students that would serve the underserved. That's only one bill. The next bill is HR 2470, Accessing Higher Education Act. This is $107 million. This is to change, and this is the second time Congressman Raul Ruiz introduced, and we talked to him about these ideas a long time ago. The idea would be take the Department of Education funding, which is for K through 12 and some money for graduate education, not HRSA's money, but the Department of Education money, and put in 4-year institutional grants to provide funding for your students to go into graduate school, so into medical school, for the purposes of healthcare occupations. And that means medical school, nursing school, dental school, whatever occupation. And also to have special programs in high school for supporting high school students that can take some college credits. When I was at Sacred Heart of Mary, I went to East LA College, just for, I think I took tennis and I took something else, but it was college credits. It was just the idea that you could actually go to college as a high school student. So those are two. The third one, this is the big one, Senator Kane, and actually Bernie Sanders is now the Senate chairman of the Health Committee on the Senate side. He had a huge hearing early this year because all of the workforce programs of HRSA are funded every 5 years, authorized. And he had this huge, all of the Democrats, all of the Republicans showed up that are on his committee, the Health Committee. And he had 4 people testify. One of them was one of our board members from New Orleans. One of them was the president of Meharry. And what Meharry asked for was $5 billion for HBCUs. And then there was a couple of women that were nursing professors. Everybody talked about the problems except for Meharry. And that's what we have to do, start demanding that we have better bills, legislation, and other efforts at our schools for our students to succeed and to increase our numbers. But anyway, Senator Kane and actually Congressman Costa started a bill. Costa was the congressman representing UC Merced, which really should be the next medical school in the state. He started a bill to expand, it's called Expanding Medical Education Act. So Senator Kane's office asked us how to improve that bill. And it basically gives HRSA the grants to colleges to establish new medical schools. So UC Merced, being a college, could establish a medical school. The medical schools that are established could be MD or DO schools, have to be in underserved areas. That's the focus was for Merced. Costa was the congressional districts got changed. So Costa no longer is showcasing this. But Senator Kane on the Senate side is. The biggest issue is that he would have underserved areas with the focus of the colleges that get the money be HBCUs or minority serving institutions. And I leave it up to Assemblyman Arambula to tell us in California which are the MSIs, but they're all designated by how many percentage of minorities you have. And then the last bill, again, is Bernie Sanders' bill, Primary Care and Health Workforce Expansion Act. And this reauthorizes all the minority bills, programs that we know, the HCOP program, the Centers of Excellence, the AHEC programs. But what it does is create a whole new program to increase primary care physicians, and under that, increasing minority physicians. The original bill was to give $300 million only to HBCUs. We complained about that. He changed it to 20% formula to HBCUs. And Fernando, we know from way back, all the centers of excellence have had formulas, but 20% money to HBCUs, the rest to go to MSIs. So there's your Hispanic centers of excellence and your Hispanic serving institutions, and he also designates the primary care, I'm going to say primary care as internal medicine, pediatrics, family medicine, as we all know, but includes OBGYN, geriatrics, and psychiatry. Emergency medicine wasn't included. The other thing is that the primary care medical schools that get the funding have to have less than or up to 30%. I think it's 30% primary care graduates, so that there's a way to target the funding to those schools that have a track record of primary care training. And again, it's $300 million for increasing doctors. The other part of this bill is to increase teaching health centers, which has been a trend, right, from HRSA, another $300 million. And the whole idea is to increase the enrollment of medical students and to give the money for faculty, infrastructure, clinical support, research support, and student support. And all of these bills create funding for students to actually have funding for their tuition and the scholarships for tuition and living expenses. So let me just end with the one thing I from NHMA's perspective and the National Latino Physician Day is we really do need an advocacy network, because there's so many individuals who are interested in learning how to change policy, but they don't know how to do it. One day meeting isn't enough. We need to have a network of young doctors and pre-meds who can write letters to their congressmen, write letters to their senators, and engage with their staff in a way that nobody else can. Because you can explain your stories, and you can explain the importance of leadership in our communities. And I'll just say that we do have an NHMA Leadership Fellowship for doctors. If anybody's interested, they have to be 5 years out of training, and it is a year-long program. We've had 3 rounds with this administration with CDC, and we have a new Leadership Fellowship just for California, supported by HealthNet. And again, we just had our first round of leaders taken to Sacramento. Our leaders for the national program goes to Washington, D.C. And I'll just end there by, again, congratulating Michael and Cesar for what you've done. And we hope to strongly support and to participate in anything you do. And we also invite you to introduce NHMA to your network and to have more of the doctors all work together through our advocacy. Thank you.
Dr. Rios has been just an amazing light of inspiration. We've had a lot of conversations, and just thank you for being so inclusive. I want to bring up to the stage Dr. Rena Thomas, the Associate Dean of Diversity and Medical Education at Stanford, and the Vice Chair of Diversity and Inclusion for the Department of Neurology, who has also been a mentor. Can you guys see the theme here? A lot of mentors. Yeah, it's not a coincidence, you know. So Dr. Rena Thomas and JP, she will be introducing Dr. Sánchez, and we'll use your computer. Okay.
Bienvenidos a todos. Thank you for being here. Thank you to my comunidad. Many, many thanks to Dr. Cesar Padilla, Dr. Michael Galvez for bringing this familia together today in celebration of National Latino Physicians Day. Let's give them a round of applause. As I looked around the room this morning and saw the many, many people who I would consider a part of my extended family, I was really pleased to see that the grassroots effort that you all have done has really brought a nation together in favor of a movement that I really think we can actually be at Stanford Medicine part of the leading this cause. It is my pleasure to introduce Dr. John Paul Sánchez. Dr. Sánchez serves as the Executive Director of the Latino Medical Student Association. This is an association of over 3,500 Latino medical students from across the country. He is currently the Acting Vice President for Diversity, Equity, and Inclusion at the University of New Mexico Health Sciences, and is the incoming Dean of the School of Medicine. Yes. At Universidad Central del Caribe College of Medicine in Puerto Rico. Welcome to the stage.
All right, let's connect. It should be just plugging it in. There it is. It's just taking time. There you go.
Okay. Good morning, everyone. Buenos dias. I gotta say, it is a really touching moment to be with you all today. I feel like I'm representing the East Coast as a Puerto Rican who grew up in Bronx, New York, Nuyorican to some. But this has got to be one of the best Latino Hispanic Heritage Month events that I've ever been a part of. So thank you again, Cesar and Michael, for leading this charge and this new movement. Congratulations on all of your accomplishments. I just wanted to start off with a little bit of perspective, because I think that whenever we come together, we're here because of the role models, the mentors, and the sponsors who have come before us. It's interesting that it's taken so long to have a day about our community, right? Latino, Latina Physician Day. I want to take us back that even in the 60s and 70s, our leaders who are here in the room, like Dr. Rios, Dr. Mendoza, and many others, were talking about how to increase representation. And I'm so grateful for their mentorship and sponsorship that has allowed me to serve in my upcoming role, but also to acknowledge that our movement over the past 50 years hasn't been easy. The formation of the Latino Medical Student Association dates back to the 1970s in the Northeast, when medical students and pre-med students, like many of you in this room, came together and said, we need something different. They connected with people on the West Coast, including the Chicano Medical Student Association, which Dr. Rios was a leader in and was a part of. She led a move to also bring together medical students in the Midwest as a part of La Raza Medical Student Association, which spread to become an organization known as the National Network of Latino American Medical Students in the late 1990s, reaching out to students in the Southeast and Southwest to also build what we currently have as the Latino Medical Student Association. And I just want to highlight that because we're talking about another moment in our legacy and time where we're going to see great change with the Latino Latina Physician Day. I also want to introduce a new term to you all because as we talk about being Hispanic, Latino, many of us carry different terms of identity. And as we think about what it means to be 20% of inhabitants in this country, we have to move beyond just limiting ourselves to recognizing just one term or identity. And one thing that LMSA has created is this new umbrella term of who we are, which is titled LHS Plus, which stands for Latina, Latino, Latinx, Latine, Hispanic, Spanish origin plus. Yes, let us embrace our cultural roots, how we identify in our families and our communities. But if we're really going to demand and expect funding to support 20% of our population, then we also need a term that reflects that. I'm not going to harp on these statistics because you're fully aware of who we are and our numbers within the country, 20% and even more so. I want to acknowledge and recognize that the largest proportion by far are individuals of Mexican, Chicano identity. Many parts, including the land that we stand on right now, was Mexico, right? Including the state that I currently serve, New Mexico. Many of us say that we're Hispanic serving institutions, but there is this question right now. Are we truly serving Hispanic students, or are we solely Hispanic enrollment organizations? For individuals within our community, a common thread is our language. And for many of us across generations, what we do at home and speaking with family, our parents, or abuelos and abuelas, is speak in Spanish when we're having harder, difficult days or when we need support. Another important finding by the Hispanic Pew Research Center is about 6 in 10 Hispanic adults say what happens to other Hispanics affects what happens to their own family and community. And that's why I'm so grateful to bring the Hispanic Puerto Rican perspective from the East Coast and say, I'm here to support you and build that connection. And where do we see the greatest growth when we talk about being 20% right here in California, Arizona, and Texas? So what next, right? This is not new data. We've always known about this data. But what have we done over the past 50 years? Have we evaluated our successes and challenges? And what are we going to do moving forward? Otherwise, we'll have the same trends that we've noticed in the African American and Black community. And to my colleagues, when reports come out that over 40 years, the number of Black men in medicine has gone down, we're failing our community. Never should we see a report that after 40 years, the number of Black men in medicine is going down. Another startling finding, as we talk about the 6 or 7%, is that only about 43% of Hispanic Latinx physicians were born in the United States. 43%. That's less than the majority. What's going on where we can't even develop our own first, second, third, fourth generation students to become our physicians? Who's to blame? Who's held accountable for that trend? This is the reality that we have created with decisions that we've made every day over the past 100 or 50 years within our medical schools and health sciences centers. This is how our current leaders are to be held accountable and to ask them to have different outcomes moving forward. We know that our US population is 19%, but currently only 12% of medical students in allopathic medical schools are Hispanic Latino, 7% of osteopathic schools combined, roughly 10%, only 7% of residents, and only 6.9% of physicians are LHS plus. How are we really going to bring about health equity with this representation? What have we learned over the past 100 or 50 years? And this is where we stand in terms of those individuals who teach, do research, care for our patients in our centers of excellence. Our medical schools and our health sciences centers are what drive excellence and innovation, and yet we are underrepresented. And yet they want to drive health equity for our communities. Only 6% of faculty in MD granting medical schools, only 4% of our full professors who are decision makers, and you see that even behind those, there's little representation. This includes the 4 medical schools in Puerto Rico that 98% are Hispanic Latino. I just want to give a shout out to our current Hispanic Latino deans of our allopathic and osteopathic. There's only currently 10 of the 200 allopathic and osteopathic medical schools across this country. I'm not going to belabor the points of where we stand in terms of health disparities. The reports are all out there of why we need to do something different. And I'm grateful that in partnership with NHMA and MOLA and other organizations, LMSA, over the past 50 years has dedicated itself to supporting our pre-medical medical students, residents, fellows, faculty, and physicians to make sure that at no point during medical school or serving as a resident or a faculty member that our community members have to be alone or isolated or just viewed as a percentage, but rather to serve them in the way that they deserve if we're going to advance health equity. The organization, and this is a little bit of putting it out there, we were able to pull together a book on our 50 years of history of LMSA, titled Latino, Hispanic, or of Spanish origin identified student leaders in medicine, recognizing more than 50 years of presence, activism, and leadership, honoring many people who came before us. And I encourage you to share this in your pathway programs. And so that you know about the generations that came before you, our triumphs, our mistakes, and what we need to do differently moving forward. And as our distinguished leader, Dr. Rios, mentions competencies, LMSA has already started the process of a health equity competencies and milestones curriculum project. How are we going to advance health equity if we haven't addressed within the standing curriculum of our medical schools what we need to be teaching? Medical school is about competency-based medical education. To this day, really, there's never been a national effort to think about what are those competencies and milestones. And I'm grateful for the leadership of Dr. Davis from UCSF, who's here, and Dr. Mendoza from Stanford for being on this committee to bring this about. And I have no doubt within the next year, you'll be seeing a document with a lot of great teaching materials where we'll work with all of the leaders of medical schools across the country to integrate this. I believe this is the first project of its kind to bring forth competencies and milestones of any of the underserved, underrepresented communities. Lastly, this is my big thought that I ask you to partner on and think about. We have always had schools, medical schools, dedicated to underrepresented populations. In part, I am a product of HBCUs, having done a pathway program at Morehouse School of Medicine. Morehouse, Meharry, Howard, and now Charles Drew have existed to increase the number of African American and Black physicians in this country, which is sorely needed. Albert Einstein College of Medicine, which I attended, was created because at one time, individuals of Jewish identity weren't given a fair chance of being accepted or being allowed to be physicians. And we know that we have 4 medical schools in Puerto Rico, the only medical schools across the United States that actually teach in Spanish from day 1 to the final year. My question to you is, isn't it past time that we actually have a bilingual, bicultural, HSI Hispanic serving medical school for the 20% in this country? Should students have to be forced only to speak English to succeed in medicine? Don't those students deserve better? Don't our patients deserve better? So my question to you is, where will that first HSI bilingual, bicultural campus be? Will it be here in California? Can you say that again, please?
Yes.
Yes, absolutely. Will it be in one of the other LMSA regions? We currently have 5 regions. Do we need to be limited to one state or one school? We know that Morehouse recently received $100 million, over $100 million, to expand its exceptional medical education system across the country and start 5 regional campuses. I'm going to make a bold statement. We don't need solely federal dollars to do this. We don't need to ask non-Latinos to support us. At some point, we just need to do this for ourselves. We need to do this for the next generation. I want to thank a group of people who've already started to come together, including Emilio Carrillo, who started the first antecedent organization of LMSA back in 1972 for serving on this committee, and many other individuals. And I want to leave you with this thought from Cesar Chavez. True wealth is not measured in money or status or power. If you're sitting in this room, you've already made it. You're at Stanford. At Stanford, you already have position, money, and power. It is measured in the legacy we leave behind for those we love and those we inspire. As we plan our own medical school, I leave you with those words. Si se puede. Thank you.
Oh my goodness, I got chills. Escalofríos. Next up, I want to introduce Dr. Bonifacio. Sonia is one of our neonatologists, professor. Gracias. And she'll.
Good morning. I'm Sonia Bonifacio. I'm the professor in neonatology, and I'm the inaugural faculty director of DEI Strategic Initiatives for the Department of Pediatrics. I'm still figuring out what that means. It's a great pleasure to introduce my friend and colleague, Dr. Katherine Bianco. She's a clinical professor in the Department of OB-GYN in the Division of Maternal and Fetal Medicine. We made it. Since joining Stanford in August of 2015, she's mentored nearly 40 trainees with a primary focus in Latinx students. At Stanford, she's also the director of the DEI Committee for the Department of Obstetrics and Gynecology, and she directs the School of Medicine's Spanish course, a 9-week learning rotation where students study medical Spanish and improve their proficiency in the language. Dr. Bianco is the director of the Stanford Clinical Opportunity for Residency Experience, the SCORE program, a program that brings fourth-year medical students from diverse backgrounds. Please join me in welcoming her to the podium.
Thank you so much. And this is just such a wonderful introduction. Thank you. Thank you for having me here. And it's just a dream come true, I would say. And Sonia and I, we started as a fellows, and now here we are, clinical professor at Stanford University. I'm going to read because this has been a wonderful morning and I want to make sure I make sense. Buenos días. Yo soy la doctora Ilayali Katherine Bianco. Yo nací en los inner cities of Philadelphia, en una sala de parto cuando mis padres vivían aquí, pero yo fui criada en Caracas, Venezuela. Soy lo que se puede decir un orgullo latino. Estoy muy agradecida por la oportunidad de estar aquí y la oportunidad de representar a una mujer latina en la medicina académica. Creo que represento el 2% de las mujeres académicas en California, 1 en 200. ¿Ok? He estado muy agradecida de vivir en California, un estado que representa la 5ª economía de Venezuela. Y creo como o sea, el doctor que nos acaba de dar una charla espectacular ha enseñado cómo es posible que no hemos avanzado más. Pero por eso estamos celebrando hoy este día y vamos a seguir para adelante. Como todos hemos sabido aquí, voy a avanzar mis slides. El 40% de la población en California es latina o de descendiente hispana, y donde cada persona que ha estado aquí presentando en el podio enseñando que somos 6% nada más, los physicians que estamos aquí. Y como médicos tenemos que entender, cuando tenemos la capacidad de hablar el lenguaje de nuestros pacientes, no solo tenemos la capacidad de entender desde el punto de vista del idioma, pero desde el punto de vista de la idiosincrasia de nuestros pacientes. No solo vamos a ayudar a nuestros pacientes desde el punto de vista de curar la enfermedad, pero de entender su alma. I'm here not to speak about me. I'm here to be a voice for those that are less fortunate. When we think about personalized medicine, it's imperative addressing language preference and cultural humility. The data is clear. Cultural background, healthy disparity, mitigation policies must contain initiatives where the ability to speak and understand cultural background in the language of preference of our patients needs to be highly considered. As you will appreciate, I start my presentation in Spanish to highlight how uncomfortable must be wanting to understand and not be able to do so. I joined Stanford School of Medicine 8 years ago. I came from another place, few miles north from here. And I was pleasantly surprised that I was able to communicate in the language of preference. This language preference was Spanish, okay? I was very happy to be able to talk to my patients and their relatives in their language, but also my staff, my people. I was able not to speak Spanish, but share cultural backgrounds and experience. And I've been very happy 8 years. Okay, for example, as Cesar explained, here in the Stanford Children's Hospital, when a translation service is called, 80% of the time is Spanish-speaking people, Spanish-speaking kids, mothers, and relatives. And that's where we have to realize where the need is here and where we have to be meeting the people. So having a translation service where it's available 24/7, it will guarantee that we can decrease the unmet gap in health disparity. Let's use what we just all survived, pandemic, COVID-19. What happened to the Hispanic population? Remarkable. We still having the shakes and the wave of our population. There was remarkable health disparity. And so what I've been able to be is a silver lining for us to recognize as a physicians, to have a definitive responsibility. And like somebody just say, we're so privileged, we're Stanford. Yes, we are, and we need to look for others. Like we need to look for this health disparity and how to address it. And going back to Dr. Padilla, why? Let's start with why and how. So what do we propose here? How we can help? How we can get this unmet gap? Things that I really believe is supporting the next generation of Latinx in STEM. Starting early, we have a high schooler here, and he's so excited to see you here. I'm sorry I'm singling you out, but I just made you, and I'm so proud of you. Moreover, people in academia, people in medicine, people in science, people in research that can help us with this, alleviate this urgency, because we just saw the numbers. There is a sense of urgency here, year through year through year, and we're still not seeing changes. So definitely, I believe in academia, I believe in education, I believe in helping. Stanford has a wonderful different pathways that we can use, and I'm actually a leader of many of those, and I can show in the last 8 years how effective they have been. So what are those? SCORE program, the Stanford Clinical Opportunity for Resident Experience. These are medical students in third year that otherwise maybe would never have the opportunity to come to this top-notch medical school and clinical and get experience. We house them for a month, we teach them, we embrace them, and we recruit them. How about leaders in health disparity program? Dr. Felipe is one of the leaders on there. And what do? We bring them just before they start medical school. We give 8 weeks exposure to research, and we start from the beginning. How about the other program? Racial Equity to Advance and Community Health Reach. One of the collaborators with Black Historical College, like we just pointed out in the beautiful map, we're doing that now. And we are starting with the first and second years of these medical students, and we bring into Stanford and we show that we believe, we want to support them, we want to recruit them, and we want to retain them. So as a director of the DEI in my department, I fundamentally believe in the mission, and I leverage funds from my department to support not only all these different initiatives, but also to deploy my trainees, my faculty, and my staff to many other organizations and society meetings, like the Latino Medical Society and the SMA. I have partnered here with Latia. We have gone every year to those meetings, and that has guaranteed another way to recruit and to support these students, starting from high school, undergrad, and above. So other initiatives that we can explore at Stanford Med is creating a robust collaboration with local Hispanic organizations and community center leaders. In our zip code, there's so much need. We don't have to move out of our nose. There's so much need in our community. And Cesar and I, and Rina and I, and Sonia and I, we all have a conversation about here. So even within our zip code, we can make so much tangible difference. So we can make sure that we partner with our local leaders, our community doctors to help this susceptible community. And I want to finish with a little bit of stories. And as you can see here, I have a lot of this gallery of pictures. To the top, we have the Stephanie Melcher. Dr. Stephanie Melcher was out, and she gave us the opportunity. She was from the Central Valley. She graduated in OBGYN residency. Now she's back at UCSF friend of faculty, assistant professor. Who we have to the right, she supports us in our SCORE summer gatherings. There are SCORE students, where I now have a PGY2, Dr. Bloomer. What do we have down? We have another SCORE group that we just celebrated in this beautiful courtyard this week, where we have Dr. Graciela Caravello, where we just recruited as well, and she's our PGY1. We always have to the right, we have Wendy Cazares, it used to be and is still a pioneer here in the School of Medicine, helping in internal medicine with diversity. And we have Kate Cha, and we have other doctors here that we supported when LSMA was a local chapter. Who we have here to the left, to the right, Stanford Med, Dr. Robles. Dr. Robles not only for Stanford Med, she's a resident and a fellow, and now she's an attendant at UCSF. So not just like you were saying, oh, we just discourage, we just gotta do primary care. All those 5 physicians that were maternal fetal medicine, and there were 3 of them were Stanford Med, they graduated in another place, they went to residency, they went for fellowship. So I wanna close because I think too much time to say, yes, sí se puede, and sí se puede cambiar. And here is a place where Stanford has shown when you put the leadership in place and you support it, we can move forward tremendously. I want to close because I want to make sure that I recognize Dr. Padilla and his associate. I want to make sure that I say thank you to allow me to be part of this. We have to celebrate. We have to be very proud of what we have done so far. And I want to recognize the trailblazer of Dr. Fernando Mendoza has been a tremendous mentor to me, and mi amiga and rock star, Dr. Rina, our vice chair.
I just want to say, working in labor and delivery, when Dr. Bianco's on call, roughly 30 to 40% of our patients are Latina, and I call Dr. Bianco. It's something that's just hits the heart when you look at the data, guys. 7 out of 10 women who died of who were pregnant of COVID were Latinas in the state. 7 out of 10. And so it's something that pulls you deep into a place where, when I call Dr. Bianco and we're talking to a Latina patient, that's our cousin, that's our prima, that's our tia, it's something beyond understanding. It's something that really hits the soul. So thank you, Dr. Bianco, for your advocacy. Next up, I want to present my mentor from residency. What? My mentor, Dr. Antonio Hernandez Conte, is a partner with the Southern California Permanente Medical Group. He practices in cardiac anesthesiology. When he was my mentor, I did my residency at Cedar Sinai. And he's currently serves at Kaiser Permanente. Dr. Conte is a clinical professor at the Kaiser Permanente School of Medicine, the regional co-chair of the LGBTQ plus committee and the EID LGBTQ plus physician director at Kaiser Permanente Los Angeles Medical Center. Dr. Conte is a graduate of Brown University and obtained his medical degree from the Boston University School of Medicine. He completed his residency in anesthesiology from Yale and his MBA from the University of California, Irvine. Dr. Conte is currently the president of the California Society of Anesthesiologists, the first Latino president of the California Society of Anesthesia, and represents California on multiple executive committees within the American Society of Anesthesiologists. Dr. Conte.
Just connect up. All right. Let's take a second. All right, so thank you so much, Cesar, my brother. Can you see it? Oh, whoops. We don't want to do that. Oh, Ben. Good. All right. Thank you, Cesar. Thank you, Michael, for inviting me. Thank you, Stanford University, Dean Minor, for hosting us today. I want to spend a little bit of time talking today about the hill we climb, my past, our present, and our future, most importantly. As Cesar mentioned, I am the president of the California Society of Anesthesiologists, the first Latino president in our 75-year history. While I am proud to say that, I'm also sad to say that as well, because it's taken so many years. But the CSA is one of the leading anesthesiology organizations and the most forward-thinking, and we've been pushing the conversation at the national level, and we were the very first to advance our own committee on justice, equity, diversity, and inclusion, what we like to call the JEDIs, for everyone. And we were also one of the very first sponsors who jumped on board when Dr. Padilla and Dr. Galvez approached us with the concept of National Latino Physician Day. And we're currently celebrating our anniversary. So a little bit about my journey. I'm the product of pathway programs. I grew up basically in an impoverished household in Florida. I went to public, elementary schools, middle schools, and high schools. I was part of sort of the STEM pathway programs that were developed for gifted students in Florida, and was identified kind of as an early age. And luckily, I was one of those few people who got into a couple of really good schools, and I decided to go to Brown. So right before the summer that I was about to matriculate at Brown, I got a letter back in the days when we got letters in 1983. Please come participate in this special program that was federally funded by the Health Careers Opportunity Program. It was called Pre-Med for Sure, Pre-Med for Keeps. And it basically brought people in who were about to come to Brown, who were interested in science and math, but also it brought people in from Xavier University, Morehouse, Meharry, Howard, historically Black colleges who had been identified as potential candidates or sort of people who may sort of path over to a career in medicine. And my time at Brown was really, really wonderful. And I have to say the mentorship I had there and the structural support I had there was an amazing, amazing time for me to sort of be able to launch into a career in medicine. But unfortunately, when I arrived at the Boston University School of Medicine, it was probably 180 degrees opposite of what had happened at Brown. No support, no mentors, no community, no structure. In fact, I almost felt like the 10 of us who were Black and brown were actually tasked to fail, not succeed, and only 2 of us graduated on time. So the power of mentorship and support and structure is extremely critical. Luckily, things changed around when I arrived at Yale, and you know, Dr. Paul Barish, who was a legend in anesthesia and sort of rivaled Dr. Ron Miller at UCSF, he was extremely intentional in his ability to mentor us, and his successor, Dr. Roberta Hines, who I still stay in touch with to this day, did so as well. And so they led me down a path where basically empowered me and enabled me to sort of continue on my career trajectory. But if you look at the people who I've kind of put up here, you know, none of them are Black, really. None of them are brown, and certainly none of them are LGBTQ until I arrived at Kaiser Permanente around 7 years ago. And, you know, I'm not sure if it was Kaiser Permanente or if it's just because we've sort of made the leap and times have changed. But I finally sort of work in a place where I can identify with people. And I have to tell you, it's made a big difference because the doors are not necessarily closed. And certainly all of us, I think, as Latinos, people of color, people from multicultural backgrounds, we often feel like we're here, we're proud, you know, soy orgulloso, pero nobody sees us, nobody hears us. We continue to be marginalized, you know, but I think the time has come that I think most of us know that enough is enough. You know, we occupy major, you know, percentages of the population in many, many states, and certainly here in California. And, you know, while we're being asked to assimilate, to sort of be the good student, to be the good Hispanic, to sort of not upset the status quo, the charge is really to upset the status quo at this point. Because when I started at Brown 40 years ago, we're still at 6%. And, you know, frankly, you know, I've been told, my family's been told that Mexicans are not allowed, that, you know, whomever is not allowed in the front door. So some personal insights, you know, that I've sort of shared, and I came of age in the AIDS epidemic. And as an LGBTQ person, I felt sort of this burden. But one thing I learned from the activists during the AIDS generation is that if you're silent, you will die. So we can no longer be silent. We must be loud. We must be proud. And we need to be everywhere in medicine, not just primary care, not just in clinics. We need to be everywhere. Our representation is important to ensure that research is done, the advances are done, the disparities get done. And, you know, we really have to speak up for ourselves and make sure that we are there at the table. But most importantly, we can't necessarily wait, you know, because not everybody is lucky enough to be at Stanford or at Brown or at some other schools. We can't expect for people to just find us. We really need to knock on the door and step forward. But I think also importantly, because the mentors and sponsors and our allies don't necessarily have to look like us. And in fact, we need to also step out of our lane and understand that we do have to step out of our lane because we, you know, are interfacing with sort of the nation at large and the world at large. And there are a lot of sort of enemies out there who don't want us to succeed, frankly. But every generation has unique challenges. In our generation, your generation has unique challenges, but we have huge opportunities right now. But we just need to know who, what the barriers are and how to sort of work around them. So, you know, why now? And already some of the speakers have touched on this. Why now? Why have we brought so much attention? Dr. Padilla, Dr. Galvez have sort of galvanized us. But I think a part of it is that the COVID pandemic really disrupted sort of the equilibrium that was happening, but really, it really uncovered the fact that Latinos and persons of color and Black persons are so disproportionately impacted by disparities in healthcare that it could no longer be ignored. You know, can no longer be ignored that we are literally living at the edges of society when it comes to access to healthcare, optimal healthcare. The population of the United States has certainly changed. When we look at the Southwest and Florida, you know, it's over 40% and probably will be over 50% Latinos and Spanish-speaking persons in the next decade. But I think also a fundamental shift is how we get things done, not only in California, but in the United States. We now have legislative representation such as Joaquin Arambula, and others, Dr. Raul Ruiz, Dr. Caraballo, who can now sort of amplify it, because that's where the real change occurs, is at the legislative level. So, you know, being a change leader, which is, I think, what all of us really are, and being an influencer, means really learning to become an advocate. And, you know, I love the word advocate because it's both a noun and a verb. You know, it's someone who does something. It's someone who champions a cause for not just themselves, but for others, for our community. But it's also a verb. Like, I'm going to be an advocate. I'm really going to take charge. You know, there's 3 different types of advocacy. We all need to master them as we sort of get on this train that's going to expand our Latino representation. We need to practice our self-advocacy. You know, if you got into an elevator with the Surgeon General of the United States and you have 30 seconds to talk to them, what are you going to say? How are you going to represent you and your cause and what you want them to hear? But we also need to advocate as individuals for one another. Dr. Felipe Perez, he does so much for Stanford. He's been such an ally for me in the California Society of Anesthesiologists, but also too, you know, how do we connect the dots so that we can advocate across systems? And, you know, effective advocacy, it really relies on a good game of chess. It's not a short game. You know, Dr. Rios has been around for many years. It's not a short game. It's taken 50 years and it's a long game. But all advocacy and change, they are both disruptive and they're incremental. So we have to be resolute in our intents and our actions. But it seems like change is occurring slowly. You know, it's 40, 50 years, 6%, but all of a sudden a disruption occurs. That disruption is today. Because change is going to follow rapidly. It is. We are connecting the dots that people haven't connected before. And, you know, we just need to be genuine intent in our actions and be united in our mission. We need to identify our blind spots and know ways to create opportunities. We need to understand who our allies are and also who they aren't, because sometimes you have to work with the people who are against you. But we most of all need to ensure that everyone's voice is heard. You know, we talked a little bit about how the number of Black men in medicine is diminishing. We need to elevate them too. We need to bring everyone up with us. Everyone who's underrepresented, everyone needs to have a voice. So, you know, it really takes a village, but this movement, this grassroots movement has really begun to connect the dots where we were working in silos and not together. And I think that's maybe why we haven't succeeded where we should have, because there's enough of us out there. There's enough of us who are advocating for this. You know, my asks, and I think you've heard some of them, but I'm going to sort of amplify them a little more. Our asks to ensure Hispanic and Latinx and other underrepresented persons in medicine are that we have more pathway programs, increase the statewide funding, the preparatory pathway programs, and they have to start in middle school and high school. We have to get our students ready for the rigors of college, whether it's community college or four-year college. It has to start very early. We have to have funding. Dr. Rios talked about some of the funding bills that will be coming, and we need to make sure that we are part of that funding. And also in the state of California, that we allocate funding. You know, we're the 5th to 7th largest economy in the world. We should be able to find some dollars to advocate for funding for our communities. And lastly, we need to continue to advocate to have structural policies that allow for evaluating all of us in our journeys in wanting to become physicians. You know, certainly with the SCOTUS decision on affirmative action, we're going to have to be creative. But, you know, I believe that the SCOTUS decision is an opportunity to sort of reset and really understand and really look at it in a granular detail so that we can appreciate the uniqueness and the value that every single person who speaks Spanish brings to the table. But we also need to make sure that once you get through medical school and you become a doctor, that you continue to advance. Because I'm sorry to say, I'm only one of 18 full clinical anesthesiology professors in the United States. And there are 55,000 anesthesiologists, and I'm the only clinical professor. I'm only one of 18 Latino clinical professors. That's not a good statistic to recite. So I'd like to end today, you know, with a few excerpts from a poem by poet laureate Amanda Gorman, who spoke at the presidential inauguration. And I think it's, you know, it speaks to me, but more importantly, I hope that it speaks to all of you all. When day comes, we ask ourselves, where can we find light in this never-ending shade? We've braved the belly of the beast. We've learned that quiet isn't always peace, and the norms and notions of what just isn't always justice. And yet the dawn is ours. Before we knew it, somehow we do it. Somehow we've weathered and witnessed a nation state that isn't broke, but simply unfinished. We, the successors of a country and a time, where a Mexican-American LGBTQ anesthesiologist who arose from poverty can dream of becoming president, only to find himself presiding for one. And yes, we are far from polished, far from pristine, but that doesn't mean we are striving to form a union that is perfect. We are striving to forge a union with purpose, to compose a country committed to all cultures, colors, characters, and conditions of persons. So we lift our gazes to not what stands between us, but what stands before us. If we're to live up to our time, then victory won't lie in that blade, but in all of the bridges we've made. That is the promise to Glade, the hill we climb, if only we dare it. In this truth, in this faith, we trust. For while we have our eyes on the future, history has its eyes on us. When the day comes, we step out of the shade aflame and unafraid. The new dawn blooms as we free it, for there is always light. If only we're brave enough to see it, if only we're brave enough to be it. Thank you.
Thank you so much, Dr. Conte. And let me just tell you, from my time being a resident, the only Latino resident, which is sad because, you know, I just hear that so much in residency, being the only Latino who was represented in my residency program. Having Dr. Conte there was just absolutely something that was just heartwarming and something supportive. I'm just gonna come, here we go. Okay, so next up we have Dr. Felipe Perez. Dr. Felipe Perez has also been a great mentor to me here, and I just have to say, Dr. Perez, that I wouldn't be here today. Also, you know, if it wasn't for your inclusive just demeanor and opportunities, along with Dr. Thomas. So thank you.
Thank you, Cesar. Buenas tardes. Yo soy el Dr. Pérez. Soy un pediatric and adult anesthesiologist. I'm here at Stanford. I also have the distinct pleasure of being part of the ODME family, the Office of Diversity and Medical Education. A great family to be a part of. I first want to thank our Stanford Anesthesiology Department staff who has made this event possible. Thank you, Summer, Hannah, Linda, and the Internal Medicine departments for all your hard work. The things we do not happen just by us. It's a team effort, and you can see the team, the family here that's taking to put on this event. And it's just so wonderful feeling to be part of that event. I also want to thank Manny Bonilla, our lobbyist for our ASA, for partnering with NHMA and making things happen nationally in regards to our resolutions. I'm pressing this button over here. I just want to say, for those of you who are thinking about getting on the path to medicine or on the path to medicine, I see a lot of you guys here. Thank you for coming. But the time is now, as you heard. If you're waiting on the sidelines, waiting to jump in, the time is now. Our patients need you. Our communities need you. We're in a public health crisis, and you're the solution. So get on the path. We're all here. We're here because we want you here. We need you here. So sí se puede. And with that, I want to introduce Daphne Garcia Galan. She's a second-year pediatric resident at Stanford Children's Hospital. She's a SUMA mentorship co-chair, where she mentors and brings together our next generation of physicians. She attended the medical school at Texas A&M, and she formed part of the national and regional leadership of LMSA, the Latino Medical Student Association. Her career goal is to work in a predominantly Hispanic-speaking and medically underserved area, such as the one where she grew up, and she loves to live within her values, and she wants to give her speech in Spanish today to make sure she reaches those individuals who can't understand English. Thank you, Daphne, for being here.
Hola,
Hola, soy Dafne. Acabo de terminar mi turno de 24 horas, entonces me disculpo. Pero aquí estoy con todo el orgullo de estar enfrente de ustedes. Algo que a mí me pasa seguido es que cuando estoy con mis supervisores o los residentes me dicen, estamos afuera del cuarto del paciente, me dicen, Dafne, ¿cómo te presento? ¿Cómo quieres que te llame? Doctora García, doctora Galán. Y mi respuesta siempre es, doctora García Galán, porque pues yo soy los dos. Yo represento a mi cultura con mis dos apellidos, represento a mi mamá, represento a mi papá y de hecho represento a todos los que vienen atrás de ellos, a mis abuelos y a ustedes, de hecho, porque yo soy participante de SCORE y yo soy parte del MCE, parte de NHMA, so es muy importante para mí. Y al mismo tiempo, cuando yo digo mis dos apellidos, yo recuerdo que es un sacrificio que ellos han hecho por sus sueños, por un mejor futuro. Y esa esperanza no se queda en mí. Esa esperanza ustedes también la tienen. Y es algo que compartimos todos. Y este sueño y esta lucha, aunque no ha sido sencillo, esto no es una victoria, es solamente un peldaño, es solamente un paso más. Un paso más. Y algo me queda muy claro, es que cuando yo voy a ver a mi paciente y ese fuego que todos sentimos aquí, al ver que cuando ellos escuchan que hablas en español, se les ilumina la cara. Los papás te dan esa miradita que dicen, ay, ella me va a entender, ella va a ser mi voz y yo lo hago con un privilegio todos los días. Entonces, esta es una lucha que sigue y yo la comparto con ustedes. Y ya es todo.
Next, we have Margarita Ramirez Silva. Margarita is a medical student here at Stanford. She's changing our medical school culture. She's a leader amongst our leaders of medical students. She was born in Colombia and raised in Miami, Florida. While formerly undocumented and homeless, she personally experienced the downstream effects of a broken healthcare system, motivating her to pursue an MPH at Northwestern and to work on diversity initiatives here at Stanford. Nowadays, Margarita is interested in reproductive psychiatry and aspires to address the health inequities that most deeply affect Latinos in the United States. Let's hear it from Margarita.
Buenas tardes, mi gente. I feel so blessed to be here, and I want to say thank you to all of you for your amazing words. Words really make a difference, and I wanted to share a quick story on how words made a difference for me. So when my family first got here, my mom cleaned houses, and since she's a single mom, then I would go clean houses with her. And we were able to go to this very beautiful house in Miami owned by a doctor. And whenever I would go with her, I'd ask her, Mommy, how can I help you? And she would say, oh, well, go to pues ve a la biblioteca, to the library, and help mop a little bit. And also, like, you know, if you can read a couple books, like become a little smart, that'd be great, so you can pay the bills later. But be careful with all the books, put everything back in its place. And I said, okay, Mommy. So I would go with my bucket and I would mop. And then I would go through all these beautiful, like leather-bound books with these intricate diagrams. They were just so gorgeous. And one day I was absorbed in that, looking at the human body. I was looking at the brain, and suddenly, I hear these footsteps approaching, and I'm like, ay, el doctor. So I'm over here running to put the book away, and my foot gets stuck in a bucket. So I'm like in the bucket that I used to mop, and I'm like hobbling, trying to put the book back. But then the doctor opens the door and he sees me, and I'm so scared because I think my mom's gonna get fired. And then he laughs and says, you're too smart and curious for your own good, huh? Those are great qualities for a doctor. And I was like, what? Because I had never heard anyone tell me those types of things. And I was like, me, a doctor. I mean, this was at a point where I didn't even think I was going to go to college. So those words really inspired me, and they really set, they were like a seed that began to sprout in my head. And I do want to note that this seed did take many years to sprout. I was undocumented and I lived in fear. Not only that, but growing up, I saw the mental health of people deteriorate around me due to all of the stressors that they faced. They ended up self-medicating with drugs and alcohol. Other people, like my mom, worked like mules for just obtaining basic necessities, neglecting their physical health in the process because they had to, and they ended up ill. However, instead of allowing these injustices to break me, I use them as fuel for my ambition. And although some may consider my experiences less than ideal, I am grateful for them because they gave me drive, perspective, and most importantly, the ability to understand and connect with the patients I serve today. Going back to my initial point regarding the power of words, I want to reflect really quickly on what happens when we start just throwing around words, just using them as buzzwords. Diversity and health equity have unfortunately become that in some cases. Everyone wants to drop health equity in conversations, but not everyone is willing to act on this. And I think this is exactly why it's essential for people like us to be in medicine, because for us, health equity isn't just an intellectual curiosity or something to talk about in seminars. It's part of our survival, literally, because achieving health equity, without achieving health equity, our moms, tias, hermanos, primos, etc., will continue to die and will continue to suffer. So for all my fellow young Latinos out here, this is a call to action. Prior generations have built this amazing platform for us, and now it's time to act. We are the wave of change our community desperately needs. Thank you.
By the way, Margarita was on Univision the other day. Felicidades. Univision. So next up, I want to bring forward our esteemed guest, Dr. Joaquin Arambula, who was elected in 2016 to represent the 31st Assembly District in Fresno County in the Central Valley. He is the first Latino physician elected to the California State Assembly. Dr. Arambula proudly represents a district that includes most of the city of Fresno, the rural cities of Fowler, Sanger, Selma, Orange Cove, and Parlier. I don't know if I'm saying that correctly. I'm sorry. Arambula's experience as an emergency room doctor in Selma forged his determination to improve healthcare for all people, especially the most vulnerable. He saw the emotional toll and financial hardships of people struggling with illnesses that could have been prevented with access to quality healthcare. Dr. Arambula has also obtained millions of dollars for the 31st Assembly District to benefit its communities. These efforts include securing $70 million for transformative climate communities to invest in disadvantaged communities. So I want to welcome Dr. Arambula. Thank you so much for coming.
You know, I'm going to begin if I can. It's hard to follow those students, and so I'm going to appreciate Dr. Garcia Galan and Dr. Ruiz. Can we help to give them another round of applause? I always find it so helpful when you are reminded of your inspiration for why we all serve. And so I'm going to tell you a little bit about my story, my origin, and how I have leaned upon my elders who have given me a chance to be here in this great state. Because my grandparents came to this country without papers and without fear, but they came during a particularly xenophobic part of our American history. It was the largest mass deportation that we've ever had in our American history in the early 1950s during Operation Wetback, that my family was swept up and deported from this country, that my father is an American citizen in. And so we learned firsthand that not every state sees us as human beings. Some see us as labor and don't give us the dignity and respect that we all deserve. And so we migrated from Texas here to California, where we ended up in Delano during the middle of the farm workers movement. And I will speak about my uncle, who was an organizer for the UFW in 1965 at the DiGiorgio Fruit Corporation to ensure that we could fight for things like a minimum wage. But my grandparents, who never went to a single day of school, who never learned to read or write, also instilled in us a passion to pursue education and to give back to your community. My father was one of the first handful of Latinos to ever go to Harvard. He also did go here to Stanford and ultimately became a lawyer. My path and passion was towards healthcare when you live in the central San Joaquin Valley. I will tell you about what it's like when you have the worst air quality in our nation, where we still have 1 million Californians who don't have access to clean drinking water. I'll tell you the effect of those social determinants of health that oftentimes were funneling people to come and see me as a physician who worked in the emergency department in Selma, the raisin capital of the world. And it was there that I saw firsthand 50,000 patients over my decade. And what I saw were people who oftentimes could not seek preventative care in any other means but to come to the ER. And they did that because of their status and because of their fears. And too often we have that injustice in our community that people are not allowed to have healthcare insurance despite paying into systems that they can never benefit from. And so I decided to do something about it. I felt that call to action when you feel an injustice and are an advocate for your patients. So I decided to leave my profession and to run for office. And now I'm a representative at our state level, representing half of Fresno County and 500,000 people. Now, for the last 7 years, I've worked as the budget subcommittee number 1. It doesn't sound like much, but I've been the chairman of that committee. It's the subcommittee that oversees every dollar that our state spends in health care and welfare, every program, whether or not that's Medi-Cal or social services or adult protective services or child welfare services. We have programs that our communities are reliant upon. And we heard about how our Latino communities during this pandemic couldn't take the time off. Yes, because they were essential, but also because they had to put food on the table and keep a roof over their heads. And too many of our families were exposing themselves to danger and know that we must uplift our social safety net and make sure that our government is working for our communities. And so in that role, I've helped to advocate to make sure that we're spending our dollars on each and every one of our community members. And I've been leading a movement through grassroots organization that has become the largest healthcare expansion in our country since the Affordable Care Act in Health for All. We've enrolled, as of today, we've enrolled 650,000 individuals. Our children, our young adults, and our elders and seniors over the age of 50 after this pandemic of the century are all now covered regardless of immigration status if they are income eligible. Starting on January 1st, we will cover the remaining age population, 26 to 49, another 700,000 individuals. 1.35 million Californians. Now, I know where I come from, so many of our families are mixed status, where at least one of their parents don't have status. And when we can give each member of that family the dignity and respect to seek preventative care, we can start affecting health equity for our communities that have been historically left behind. And so I'm grateful to be here in the great state of California, where we have a legacy of leading and investing into our communities that have needs. But we have a responsibility as well to make sure that the providers are reflective of the communities that they serve. Now, it's a great responsibility being the first Latino physician that we've elected to the state assembly. And so I've spent my time to make sure that we work on those pathway programs. Programs like the Health Profession Career Opportunity Program, which was mentioned earlier, that now has 4,800 slots across 20 universities up and down our state. And I'll tell you about how we moved it from a federal program to a state program with intentionality to ensure that we could include our undocumented population that could not qualify for those federal dollars. I'll speak about the California Medical Scholars Program, since we had 2 community college graduates who were here who are helping to lead the Latino Physician Day as a program that we initially piloted and that I successfully got the budget allocation this year to make sure that we can grow and scale. I'll speak about the investments that we have into our international medical graduates to ensure that those who do have foreign credentials can come and do residencies here, as we have such a great need for cultural and linguistic competency for our providers. And I will speak about all of the investments we've done for loan forgiveness and to ensure that we can make those who struggle financially to be able to afford the medical education that our community needs. But we have a responsibility to make sure that our providers look like this room. Because when I look around this room, this reminds me of the Central Valley. It's a lot browner than most people are used to. And if I can uplift, it's a lot more female. And it's reflective again here in this room in the providers that I'm looking around and seeing. But our advocacy can't simply stop in asking for more providers. We have to affect the living conditions that our patients are living in. And that's why you will see me fighting for issues like air quality at our state capitol to ensure that we don't continue to pollute into our communities of color. We have to make sure that if we're able to prescribe medications for people, that they can afford them and that they're getting the follow-up care that they need. But to do that, you have to be their advocate. And I came up here today and spent time on this 1st of October because I think it's so important to look in the eyes of that future generation, to be inspired by them and to hope to inspire them to want to give back as well. Because when you ask more of yourself, you can do things for your community. You can make a difference and be a change maker when you put your all into it. I've seen it happen firsthand as we've changed the very systems within our state and acknowledged that we have so much further to go to make sure that we continue to build upon the successes that we've had. But to do that, we have to build in areas that have been historically left behind. Because I'll just elevate if I can. I got a chip on my shoulder sometimes, that there are geographical disparities as well in terms of representation. That I got half the number of doctors per capita as you do in the Bay and in LA. That it's twice as hard to run as fast to make sure you're providing competent care in communities like mine. And so we have to make sure that we have the opportunity to grow our own medical students and look forward to our partnership to deliver a medical school at UC Merced. But I'm going to end, if I can, in the importance that language plays. Because I learned firsthand what it means when you have that trust with your patients. When you're able to communicate with them and establish that bond, how important it is for us. And that it's a strength to your application when you're applying to medical school that you speak more than one language. That it's a benefit to us as a system to look at what our patients speak and to make sure that the providers are doing the same. This year, in light of what occurred with the Supreme Court, we are transitioning from looking at race to looking at language, where we're going to focus on threshold languages. And as you saw from the data, it's clear there's a need for us to increase admissions to medical students and for our residents who are speaking Spanish. I am reminded that so many of us come here to these United States because of the opportunities that are before us. That my grandparents, who never learned to read, could have a physician who was advocating to increase access for other undocumented is the dream that we have here in our United States. And I hope we continue to be that beacon of opportunity for the world as California continues to advance and to lead. We will need our immigrant communities that are our strength. And so I'm grateful that so many of us come from that background and have an opportunity to make sure that we are holding that door open for future generations. But we have to take moments and acknowledge the leaders who are helping to do that. And so if you'll allow me a personal privilege, we've gotten some recognition from the state of California that I would like to bring forward Michael Galvez and Cesar Padilla. I'm also going to ask Felipe Perez to come up, please.
So as we wrap up, thank you so much, Dr. Arambula, for your time, for your dedication. We have tacos waiting outside. We have mariachi. Just wrapping up, last 2 minutes here. This is a crisis. If we were to double the amount of Latino medical students, it would take 92 years to achieve adequate representation. If we don't, 500 years. And this simply, what can we do now? Let's talk about it. Let's get it out. Let's have this in our verbiage as we talk about health equity. Talking about Latino medical school, sure, this is an idea. Having a curriculum that incorporates undocumented status, for example, as learning about the barriers of our vulnerable patient populations, but a medical school open to all. If you show up to a medical school that is inclusive and leading Latino narratives, just like our HBCUs, it's inclusive of all. And let's recognize the power of bilingualism, not only in Latinos, but also in other communities as well.
And so this is where, this is a very busy slide, but there is a value, right? The academic aspect, the research aspect is vital for improving healthcare outcomes, but the recruitment of a diverse student body should translate. And so that's where we have to consider, as mentioned, bilingual skills for MD and residency admissions, and even considering expanding medical schools to meet the patient population. And the other aspect is community college and even the Cal State schools. And there is a disparity in how much are accepted, and that lived experience is so important. And the considering that this Latino medicine, this Latino aspect that we're talking about, should there be departments of Latino medicine? Should there be task force that look at this? And should there be transparency in the way that we do admissions and selection criteria for residencies? And these are hard questions, right? And this is not just specifically to Stanford. This is to the University of California. This is to all the medical schools, to the DO schools, to the new private schools that have opened up in California. We need this to change right now. And we're open to have, this open discussion is what needs to take place. And so we really appreciate everyone being here. And, we have these technology investments, right? You hear about artificial intelligence and, believing that technology will help telehealth, all these aspects. But this is, we believe that Latinos will have a growing role in our ability to increase the access to care by connecting with patients. Yes, technology can bring money, technology can bring changes, but we're here right now. The patient is here. We're here taking care of patients. And this legacy, we had to mention this. Cecilia Preciado Burciaga, she was a Chicana scholar, activist, and educator. She was appointed in 1974 with a rich history of championing Latinos in top positions. But I love this quote: Latinos must be in positions throughout the alphabet, beyond assistant, associate, affirmative action. Latinos must be also the CEOs, directors, executives, provosts, presidents. And it's just such an amazing quote, and I love that. So thank you to her, and that was brought by Modesta Garcia, an educator. Thank you, everybody, so much for being here. Happy National Latino Physician Day. Happy National Latina Physician Day. Thank you, everybody.